Good morning, everyone, and welcome. It's lovely to have you with us after a long weekend, and we have the Under-Treasurer with us. Welcome to Rachel as well. I'd like to begin by acknowledging that we're meeting on the Turrbal and Yagara land this morning, and to pay my respects to elders past, present and emerging. And I'd also like to pay respects to all First Nations people joining us online today, and to the elders of all of the lands that you're meeting us on from today. You are joining us live this morning from our offices in West End, and this is an interactive in-conversation event with the Under-Treasurer Rachel Hunter. You'll see that there is a Q&A function at the bottom of your screen, so do feel free to feed us questions throughout the conversation. Obviously, the Under-Treasurer is not in a position to answer questions about future investment, but really what we'd love to receive is any questions you have about how budgets are put together, the process, how you can influence the process, and even reflections on lessons learnt from the past. We are going to try to get to as many questions as we can, but noting we've already had some great questions come in, and we do only have an hour this morning. Look, it really is a privilege to have an hour to chat with Rachel this morning. Rachel is Queensland's current Under-Treasurer and has been in the role since May 2020. She's also been the Director General of three government departments: Department of Justice and Attorney General, Department of Education, and also State Development. Rachel's also served as the Public Service Commissioner in Queensland. Rachel started her career as a teacher back in 1977. She's also the mother of three, including twins, and is about to become a grandmother in May. Rachel has a real passion for social policy that alleviates disadvantage, and we are just so thrilled to be talking to her about the budget process today. I think it's also important to note that although we're going to focus on the budget process today, Rachel will be moving in May to take up the role of Director General of the Office of Premier and Cabinet. So moving into the role of the most important public servant in Queensland, and will continue to have a pivotal role as the Queensland Government seeks to ensure that the recovery from COVID-19 is in fact for all Queenslanders. So we are really thrilled that Rach was able to give up her time for us this morning. Can you believe it's almost May? I mean, where has the time gone? We are already in the throes of the budget process, and it is really timely to have a conversation today about the budget process, how the community services sector can influence government decisions about investment, and what lessons we might have learnt from the past. Julia Gillard famously said that budgets are about choices, and you reflect your values through the choices you make. So it is really important that that civil society understands the budgeting process and is able to influence it. That's the reason why we're having this chat today. So, Rachel, thanks so much for joining us.
Thank you, Amy.
Let's get into it. Can you explain to me how a budget is put together in Queensland, including some of the key milestones, timeframes around those, and who's involved?
Thanks, Amy. So in the 12 months that I've been in the role as Under-Treasurer, I've had the opportunity to work with the Treasurer to develop the COVID Fiscal and Economic Review in September, then a budget on 1 December, and now, of course, we're in the process of the budget build for the 15th of June. So budgets typically, as you said, Amy, reflect government priorities. And coming out of a response phase to COVID-19 and its impact both on the health and economic circumstances of Queenslanders, the government has articulated a number of priorities, and they're the driving force for a budget build. And they firstly obviously include an ongoing focus on the health of Queenslanders, the safety of Queenslanders in the context of the pandemic. But we're also very minded that the pandemic has played out differently for individuals, communities, regions, and regional economies across Queensland. So there is a strong focus in the budget on ensuring that there is equitable opportunity for people to participate in the economy. And in fact, in Queensland Treasury, we've just gone through a process of reflection around our vision for Queensland as the lead economic portfolio. And our focus is very much on a strong economy for all Queenslanders, so it picks up that sense of economic inclusion that you spoke to earlier. So how does that reflect in the budget? Obviously, a budget is a top-down and bottom-up process. Government sets its priorities, and on the back of an election, at the end of October, the government has certainly made a number of election commitments which clearly have to be funded through the budget process. In response to the impact of COVID-19, the government also made significant investment in both the response and recovery. So in all, $11 billion has been committed to help Queensland steer through the impact of COVID-19. That has to be reflected in the budget. We also have the bottom-up process where agencies, and I think this is where your interests will lie, work with their stakeholders in order to articulate their budget priorities, and that information is brought forward through the Treasury process. Typically, agencies start that work in February, March. It formalises through April, and then the Cabinet Budget Review Committee meets and considers submissions from departments in the context of both new asks but also ongoing services. And the government has made a very strong commitment to restoring frontline services. So again, that becomes a key priority. So all of that information comes forward, and this issue of making choices and how those choices reflect the priorities and values that government articulates is really important. And I'm very privileged to see a lot of that discussion occur. And ultimately, the economic problem is there are unlimited wants and limited resources, so decisions have to be made. But in terms of time frame, from around February through to May, we are in intensive analysis and discussion around the framing of the budget. And as you know, the budget will be handed down on the 15th of June.
Yes, so under Treasurer, I have to mention here Craig Stanley Jones from RAFME Queensland, who's one of our members, because he's put in a question that's very relevant to what you've just said, and it's about sort of that bottom-up part where government agencies are collecting information and evidence from potentially commissioned services and community organisations about emergent needs. Craig's question really relates to as we have, real direct frontline experience about things that are happening in the community and emergent needs. If an organisation wants to be really proactive and present that information and evidence, where should they provide that information and to whom?
So I think there are a number of avenues available to NGOs, frontline services. Some of those are through the agencies that have policy responsibility for the area in which your organisation works. Other avenues include peaks like QCOS, so that the voices of many can be consolidated and fed through to government. I know that there are strong place-based responses too. I live in the community of Logan, for example, and I have a strong invested interest in quality early childhood education and care. So the Logan Together initiative is something that I am very familiar with. And I know that from that perspective, as a place-based initiative, there's a strong voice back into government. So there are many avenues. I think the challenge for providers operating in the community services sector is to find a way that an avenue that strengthens your voice. As a single service, sometimes it can be difficult to be heard. So working with others, and particularly building strong partnership with agencies of government that have policy responsibility, as I said, for your particular service area, is something that happens not just through a budget period, but it's a partnership that happens and strengthens over many years.
So it's sort of having that emphasis on building relationships over time and then leveraging those relationships at the right time in connection with the budget each year. And I'm thinking in relation to sort of the place-based responses that you're talking about, you know, thinking about whether your local MP might be the person that you want to speak to, making sure you're communicating with your relevant contact within the department, and also, of course, giving your feedback to QCOS as we develop our budget submission, which we obviously then engage right across government with.
And all of those avenues are absolutely critical. I know that the NGO sector works very effectively with local government as well, and in certain contexts with federal government. So the ability to work across sectors of government is also something that's fundamental to a strong NGO sector.
So my next question is actually pretty future focused, and as I mentioned, the Under Treasurer is going to be moving to take up the position of Director General in Department of Premier and Cabinet, and we have a new acting Under Treasurer coming into the role, Leon Allen. So I'm actually going to direct this question to the incoming Under Treasurer, and he's going to respond to it online. And my question, Leon, is really, there are so many social issues, youth justice, child protection, domestic violence, where we know the real solution lies with early primary intervention. How do we get to a place where we shift the dial so that our real investment is up that front end into primary prevention, so that less investment is required down at the crisis end?
Firstly, thank you for the opportunity to join. It's a very pertinent question, and is always the ongoing challenge for government to balance that priority of investment in primary prevention with the need to address, immediate priorities and unfortunately to address crisis. And that's always going to have to be addressed. You can't leave those really important crises unattended. And I think our greatest example of that is the response to COVID-19. And while we didn't see unnecessarily adjustment to any existing programs, we did see significant investment that would otherwise have gone into primary prevention needed to address a crisis. And government's always going to struggle with finding the balance between that investment in primary prevention and crisis. And I think it is a key focus for government. They understand the long-term benefits of primary prevention, and it makes good social policy sense, it makes good economic policy sense, it makes good fiscal policy sense. So there's always going to be a bias for government in that regard, because they can see the long-term payback. And it is a long-term payback. We don't always get those immediate results, but government is focused on that. And so there is genuinely, I believe, a real concerted effort by government to steer as much of the discretionary expenditure into long-term preventative care. And I can see that there's programs like domestic violence where there's a real understanding and consideration of principles that can be put in place that helps government guide its investment decisions. So I think we need to keep working on it. We need to support it by good evidence, and your efforts in your respective areas is really important in feeding that information into government to help them make good decisions.
Thanks, Leon, and it is really encouraging to hear you talk about the importance and the relevance of the information and evidence that the community services sector does have and is continuing to have a real, we have a real enthusiasm for trying to use that evidence and information to make sure that we can influence government decision making. So we have received lots of great questions from our members and from the audience. Obviously, as I said in the beginning, the Under-Treasurer won't be able to answer questions related to future investment for specific programs, but we are really keen to have your questions and can talk to sort of some general reflections on programs that have been funded in the past, as well as the budget process and how you might influence it. So please keep your questions coming. Look, I'm really sorry for those technical glitches. That was very unfortunate, and particularly given that we were talking about something so important. And it was in reference to a question from Asia Rigney from Maternity Choices Australia. And her question was really about how you would, the model that her organisation is putting forward, she says, will provide better outcomes for the community and save government money. And Rachel was in the middle of describing to us how you might go about putting forward a different model, asking for funding to be redirected so that there is a better outcome and potentially so that money is saved.
Thank you. I think the evidence base is really critical when you're seeking to partner with or influence policy decisions within government. Having that evidence base is really critical. But certainly there is, from Queensland Health perspective, a strong reliance on research and evidence in terms of clinical practice. And so, again, building those relationships back into agencies, potentially at your local hospital and health service level, I think is the best way to influence opportunity to grow your service.
So, Rachel, would you say for something that's sort of new and potentially based on international experience and research and might be different to what we're doing here in Australia or in Queensland, it might be the case that you develop a relationship with your local service provider, your local hospitals,
yep.
And seek to run like a pilot, which then provides some of the evidence that then can show that it is a really good model and could be rolled out through other services.
And I think often that's how change occurs.
Yeah.
Certainly when we're talking about large systems like health or education, the opportunity to innovate is absolutely dependent on your opportunity to influence. Yeah. And I think piloting new ways of delivering services are certainly fundamental to evidence-based pathways for any service delivery.
Yeah. And so on that question of evidence, we do have a question from Helen James from Townsville City Council, and she is talking about how the community sector can influence the budgeting process, but really one of the aspects of her question is what types of evidence do you think government's interested in looking at, and how should that evidence be provided when making a pitch for additional investment?
Ultimately, the evidence talks to outcomes and the way in which the service delivers improved outcomes. And obviously, you wouldn't expect the Under-Treasurer to not mention, we're also looking for efficiency. So increasingly, as I said, government resources are thinly stretched, and we have no shortage of choice in terms of which services to fund. The issue is which services are going to yield the best possible outcome for citizens, but within an efficiency envelope. And these are always the parameters that government has to work within, because government can't do all of the heavy lifting itself. We've lent on our balance sheet in Queensland to a significant degree. The last budget forecast deficits over the forward estimates. Ultimately, we have to restore fiscal buffers. We have to be back in a position where we're able to invest in new infrastructure, new services, but without putting undue pressure on our balance sheet. And a lot of that relies on the relationships that we build with the NGO sector, with the community services sector, but also with the private sector. As an example, you would have seen that we have piloted 2 build-to-rent initiatives, which will deliver around 240 affordable housing units here in Brisbane. So the private sector has a role to play as well. And I think that the way in which we partner based on evidence, and that evidence has to be primarily about, are we delivering the outcomes we need for citizens? And are we improving those outcomes within an affordable envelope?
So, Under Treasurer, when the government seeks to, obviously you've said you've run a number of deficit budgets and, you know, there's been a crisis, so that's obviously expected. And we know that, you know, state governments around Australia have been encouraged to take on debt, that, you know, the sort of top line message has been that never has there been a better time for state governments to borrow. But as the government tries to pull that back and come back into a balanced budget, other than finding efficiencies, as in sort of reducing funding or trying to pull things back, what are the other levers that government can pull to bring a budget back into balance?
So I think there are a number of ways in which we can do that. The first is we had foregone a lot of revenue. So there were payroll tax concessions and lots of support provided to help shepherd business through one of the most difficult economic times we as a generation have faced. We are now starting to recoup or press go on revenue collection again. So that's one mechanism. And monitoring very carefully the impact of our revenue measures on economic activity. I think the second is to look to the cost of government service delivery. And you'd probably be aware that we initiated a savings and debt plan where we asked agencies to undertake a series of functional reviews to look at priority functions to ensure that they continue to be resourced, but also to look at those functions that were less priority so we could pivot resources to those that required additional resourcing. So that process continues, and it's been, we have delivered and will deliver over the forward $750 million a year from government agencies back into the consolidated fund in order to reprioritise those resources to service priorities that are acute as we recover from COVID. So government needs to ensure that we're resourcing those services that are critical, both to our response and our recovery phase, but also maintain a level of resourcing for those services that are fundamental when the community has been so significantly disrupted. And the third thing, which I mentioned earlier, is looking to ways to leverage more capital. And the private sector, you know, has indicated, you know, a significant interest in ESG and social bonds and green bonds. So we have to become more agile in terms of attracting capital, particularly into investment in productivity enhancing activity infrastructure throughout Queensland.
Yeah. And on that theme of, I guess, the impacts of COVID and trying to sort of do the two things of continuing to respond to the ongoing, I guess, impact of COVID, as well as trying to, from a budget perspective, pull it back into line. I've got a question here from Nadia Martinvik and Stephen Ireland from the Royal Australian and New Zealand College of Psychiatrists. And their question is about investment into mental health services, given the impacts of COVID on people's mental health. I guess rather than sort of speak to what future investment in that area might look like, it'd be interesting to hear you talk about how you would balance something like that is a clear emerging need against other things that are clear emerging needs, and how government makes decisions about when there's so much need and so many things that could be funded. How do you play that balancing act?
Certainly in Queensland, there was an acute awareness in government of the need to provide additional resourcing in the response phase for mental health services. And so Queensland Government injected over $46 million into additional mental health services as a direct response to the impact that COVID and particularly lockdown was having on the mental health of many Queenslanders. So I think certainly there has been an acute awareness that all of us have had to experience something that is, the word unprecedented has been used many times, but that has played out very differently in some communities, particularly where people perhaps don't have the level of social infrastructure around them that they need to feel supported through incredibly difficult times. So there is an acute awareness of the impact of COVID-19, but more broadly, the issue around investment in mental health is fundamentally playing out nationally through discussions that will lead ultimately to a national partnership agreement.
Yeah. We've got a question here from Alex Hook from Social Traders, and his question is more to less about the budget process and more about procurement. So he's asking whether Queensland Treasury is supporting social enterprises through the general procurement spend.
So the Queensland procurement policy certainly places a priority on procurement regionally, but most importantly for small business. So we are certainly encouraged to prioritise supply chains that include small business, and we're encouraged to ensure timely payments, which of course are fundamentally important. So at the moment, Queensland has reduced payment times to around 5 days. So again, that recognises that many small businesses, including social enterprises, really have a need to ensure cash is coming in the door. So I think Queensland is quite unique given the diversity of our regional economies, but what we know is more than 95% of Queenslanders are employed in small business. So I think that places social enterprises well in the context of the very proactive procurement policies that exist.
Yeah. Is there any particular metrics that government uses to measure whether they are procuring services from social enterprises? So
the Department of Communities has been very active in this space. As a specific metric, the major focus has been on small business.
Right. Okay. I have a question from Gillian Marshall from Logan East Community Neighbourhood Association, and she has asked a question about skilling Queenslanders for work. Obviously I can't ask you about future investment, but Under Treasurer, would you be able to comment on some of the benefits that this investment has had over time?
Sure. I mean, the program is a signature program for the government, and that ambition to ensure that people who are vulnerable and economically marginalised, that they have opportunity to develop the skills they need in order to be able to secure employment is fundamentally important. And we have seen significant success in that program, and that's largely because the services that have worked within Skilling Queenslanders for Work are strongly motivated to help people who are marginalised. And again, I talk to my own experience. You mentioned I started teaching in 1977. My first teaching role was in the TAFE system, and I worked with very marginalised young men who had not completed school, who were unemployed, and who entered into a program which is probably a precursor for Skilling Queenslanders for Work in some sense. And I saw the value of the capacity for young people to gain skills, gain confidence, gain a sense of purpose, and ultimately gain employment. I don't think any of us can not understand the importance of the dignity of work, as well as the economic independence and the social benefit of taking people who are marginalised through a skills pathway into a job.
Yeah. And you're saying that there has been some sort of evaluation of that program to show that it has been effective in producing those outcomes?
Yes, there has, and that's why the program, I can't talk to the future of course, but the program has been funded over successive budgets because there is an evidence base.
I've got a question here from Alison Durham from the Heart Foundation. She says there is a dilemma for a budget submission. Do we ask for big funding commitments that are needed, or do we ask for small amounts for programs or specific issues? Obviously, she points to the fact that a smaller investment is going to have a smaller impact, with a larger spend having a bigger impact, but obviously more difficult to get over the line. How would you approach that, Rachel?
That's a really difficult question, isn't it? Because I think it's both and. Sorry to say that, but again, I think that comes back to the relationship that you have with the policy agency, and in this case, with Queensland Health. And those sorts of decisions are best made in consultation with agencies. And it also talks to the extent to which the program has already built a level of evidence around its efficacy. So on the back of a smaller program that's been highly successful, you're much more likely to get traction around a larger budget bid.
And when you're talking about working with your line agency, whichever agency your particular organisation's funded by, so we talked about Queensland Health because Alison's at the Heart Foundation, but obviously many organisations would have a key relationship with their contract manager.
Yes.
But probably in these conversations you'd be seeking to influence at another level as well within government. So can you comment on sort of the role of sort of trying to influence your contract manager, who else you might want to talk to within the department, and when you think interactions with the relevant minister or your local MP might be the best approach?
So again, I think that comes back to the nature of the program. If the program has broad reach, it's statewide, then certainly working with your contract manager, but also seeking to influence at the policy heart of a department is really, really important, because ultimately a budget submission is a reflection of policy intent. I think if it's a local place-based program, then obviously working relationships with all of the stakeholders, including local representatives, is really important.
Yeah. So I have a question here from Emily Kane from the Queensland Community Alliance. And the question is, what is the biggest item you've seen funded in the budget that would not have happened without the advocacy of the community sector? Great question, Emily. Can you tell us the story of how this happened? What did they do and what made their advocacy work so successful?
I think at the national level, certainly if we look at the NDIS, that is an absolute example advocacy that has happened right across Australia, including here in Queensland, for the empowerment of people who are seeking services from a disability fund. But and that sense of empowerment is absolutely central, and that's such a shift in terms of the way in which disability services are delivered. I've had the privilege of working in the children's education and care sector when I left government in 2010. During that 8 years I was out of government, I was the chair of the Australian Children's Education and Care Quality Authority. So again, that was an example of just a significant investment by governments, both at the state, territory and the Commonwealth federal level, in the National Quality Framework, in ensuring quality standards for children in early childhood services. So again, incredibly successful. I think here the significant investment that has happened in services for the homeless through COVID is another example where clearly people who are homeless were at high risk. They're a high risk population. And there has been advocacy and a significant investment in ensuring emergency accommodation for people who have been homeless and living on the streets in Brisbane. But what that's done is actually change the service model. So again, I've seen many examples, but they are just a few.
And I think that housing example is really great because, it's really fresh in our minds how, because of the crisis, a lot of the sort of usual barriers broke down, and government and the community services sector really did work hand in glove together, recognising immediately homelessness as a health risk and needing to have an appropriate response because of that. And I may now misquote the data, but I think what we saw, the recent research shows that during COVID, around, after COVID, I think it was around 4,700 people who had been housed during the emergency response are now permanently in permanent housing. And 70% of those people come from Queensland. So that points to really the effectiveness of that bottom-up approach where the frontline services are saying this is what needs to happen, government responds appropriately, and we have such an fantastic long-term outcome. So our next question from the audience speaks to, I guess, the impact of political decisions over, so how, I guess, politics influences decision making in a budget process. The audience member speaks to the fact that some programs that are delivered are influenced by the government seeking or wanting to be re-elected. The audience member asks, in that kind of political environment, how can we really influence the government to redirect funds to invest in early investment when we know that the benefits of that are not going to necessarily be paid off during that, during the period that the government is in power?
It's a challenging question. Look, at the end of the day, I have enormous confidence in the ability of the community to determine the outcomes that have been delivered during a government's term. And I have great respect for the intelligence of the electorate. So people look to the track record of a government. I think the issue for us in Queensland is that we now have a 4-year term, a government facing a 4-year term. I understand that investment in primary intervention certainly may have a much longer lead time and timeline in terms of delivering outcomes. But again, that goes to the evidence, and we are seeing increasingly government look to shift and to invest in primary intervention. And I've seen that certainly in children's education and care. To use one example, we see it increasingly in healthcare. We see the work the Commonwealth is investing in the primary health networks to strengthen the relationship between primary healthcare and the secondary and tertiary healthcare systems that are operated by the states. So again, it comes back to evidence and outcomes, the outcomes that are achieved.
Yeah. So the next question is from the audience, is talking about, I guess, the relationship between the line agencies and Treasury. So the audience member says that they feel that they have a strong relationship with their agency and are able to have conversations about what investment might be required, but they feel that that doesn't always connect into Treasury's thinking. And so is it necessary for an organisation to also develop a relationship with Treasury, and how would they go about doing that?
So it's interesting. I mean, I'm a relatively new Under-Treasurer, and my career is not the typical trajectory for an Under-Treasurer. But I have had the privilege of leading very large organisations like the Department of Education, so I certainly understand the budget environment and the fiscal environment, but also the social purpose of many agencies of government. And coming into Treasury, I've seen significant sensitivity to that notion of purpose of government. And when we began our interview, I said that we'd done a lot of reflection across the senior executive around what is the role of a strong Queensland Treasury Department. And that sense of vision, what is the vision that should drive us? And you know, we arrived at this notion of a strong economy for all Queenslanders. And there is certainly Treasury is government's lead economic and fiscal advisor. That's its role. But in order to do that, it needs to understand the priorities of government and the breadth and diversity of services offered by government and the networked service relationships that government has. And I have seen evidence of that. So I really want to encourage people to accept that Treasury is very minded to the challenges that the NGO sector face, the community services sector face in working back into government. Government is a large, complex entity or system. I mean, we've initiated discussions with QCOS and Queensland Treasury because we want that engagement and we want that sense of shared purpose to reflect in the way we provide advice back into government. It's difficult. Treasury is an organisation of 1,000 people, so you know we're not 65,000 people. Queensland Department of Education, 85,000 people, the Department of Health. So I think you have to trust that your relationship with your service agency reflects back to us through their work as much as it does through Treasury's relationship with peak entities like QCOS as an example. And you know, there is, of course, that you know, Treasury is also responsible for providing advice to government around prioritisation. And so for some agencies, that relationship is tested at times.
Yes, yeah. So I did say, you know, you are moving next month into to Department of Premier and Cabinet, and I'm just dying to ask you, Rachel, with your strong social policy background going into that very important top job in Queensland Government, can you just briefly talk to me about the work of the social policy unit that sits within Department of Premier and Cabinet, and how that then influences services and government work across Queensland Government?
Obviously, we have a very strong social policy capability in the Department of Premier and Cabinet. And it's both responsive, so agencies obviously prosecute policy positions with the department, but it's also very proactive. And I think particularly if I look at the work the department has done over the last 12 months as we've grappled with the impacts of COVID, while I've been working in Treasury and strongly invested in the economic and fiscal response, we've worked very closely with the social policy group in the Department of Premier and Cabinet, because so much of the response has had social impact. And so it seems to me, as we move forward, there's an opportunity to continue to strengthen. It's a very strong relationship between the Department of Premier and Cabinet and Queensland Treasury, but there's an opportunity to strengthen that even further. And certainly I'll be looking to strengthen that in the social policy space as well as the economic policy space.
That's fantastic. We're looking forward to seeing that happen and being part of that, Rachel.
We will be.
Yeah, thank you so very much for your time this morning. It's been a wonderful conversation, and I'm sure our audience has found it really helpful and enlightening. QCOS has also developed a resource to help organisations put together a budget submission, sort of a bit of a how-to guide, and we're going to provide that to organisations after today's event to help you if you are still thinking about putting together a budget submission this year. It'll also be helpful next year, of course. QCOS obviously engages in the budget process every year. This year has been no different. We put together a budget submission in around February based on our consultation with members last year. We put it out as a consultation draft. We've had great feedback from members, and we've also worked across Queensland Government, across departments, to talk to them about the type of investment the community services sector is seeking. We're going to launch that submission formally in a few weeks, in early May. But as you would have seen, QCOS's top priorities this year are around investment in social housing, including a really significant new investment into building more social housing, as well as making social housing energy efficient. A new investment into community services, including the establishment of a community sector resilience fund, investment into community and neighbourhood centres, and really having an eye to a gendered lens over the development of the budget. So really being clear about what benefit this budget delivers for women in Queensland. We will launch, as I said, that submission, and then after the budget is announced in June, we will be doing an analysis of the budget as we do every year. But this year we are going to, for the first time, include a gender analysis of the Queensland state budget, so that there is an independent civil society analysis that speaks to what this budget delivers for women in Queensland. We will, as always, have our we missed it last year because of COVID, but we will have our traditional budget breakfast this year. It will be on the 18th of June, and we will be putting invites out shortly. We have secured the Treasurer for the event, so we will be having an in-conversation style event with the Treasurer on the 18th of June, and we would love you to come along. As I said, please do use our, don't think you've missed the boat this year in terms of influencing the state budget. Use our budget submission guide, have a look at it, and we'd love to hear your feedback on that resource as well. So thank you all so much for attending this morning. I apologise again for the technical glitch that we had during the event, but hopefully you still found it really useful and informative. I really encourage you, if you haven't already, to follow us on social media. We really want more and more engagement from our members, so please think about joining one of our policy networks. And as always, if you've got any ideas, thoughts, feedback, comments, please do get in touch. Thank you all again. Thank you, Rachel, for this morning.
Thank you.
And I really hope you have a wonderful day and week.